should we hold metformin in patients who are admitted to the hospital? Honestly, the practice of holding metformin in the hospital is all due to this fear of lactic acidosis. The evidence to support this is actually not very good. This was all based on the old version of metformin called fenformin, but we really don't see it with metformin. And so honestly, we probably should be using metformin more in the hospital. Patient in the hospital, I wanted to restart their metformin. Pharmacy gives me a call and they're like, hey, what if this patient is going to get a imaging study with contrast? You know, this is another one of those practices that we do. But if you look deeper into the literature, you find that this is also not really well supported either. And what makes it worse is if you go to something like UpToDate, if a patient is at high risk for contrast-induced AKI, metformin should be discontinued for 48 hours and then renal function should be checked before they restart it. But again, where's the evidence for this? The American College of Radiology, they actually recommend continuing metformin and not doing this whole 48-hour hold and then recheck the kidney function beforehand. So that's just a couple learning points about metformin, and always just a reminder that we should always question these dogmas that exist in the hospital because a lot of times they're not really founded on good evidence.